It's my privilege to introduce our first speaker, Mark Dudzic. Mark is a long-time labor leader who is the national coordinator for the labor campaign for single payer. He's been a labor leader with the Oil, Atomic, and Chemical Workers Union, OCAW, the same union where plutonium worker Karen Silkwood was killed on her way to meet a New York Times reporter about abuses at the plant, and a movie made of that for those of you old enough to remember. So Mark, thank you very much for talking with us.
Thank you, Don. Thank you, Don. Good evening, everybody. Don, just one little thing. Karen Silkwood was not killed. She was murdered. She was murdered by Kerr McGee on her way to a... Okay, well, I think I can take care of the sound here, but good evening, everybody. It's wonderful to be here. I want to thank the organizers of this event. It's great to see everybody out on a rainy Saturday night and the passion that you bring to this issue. I really want to thank PNHP. I think PNHP has been a leader in this movement. Without PNHP, there would be no single-payer movement in this country. The first time I ever heard about single-payer was at an Oil, Chemical, and Atomic Workers District Council meeting in 1987 in New Jersey, when this funny-looking doctor from Harvard, Dr. Himmelstein, showed up with, he had long hair and, you know, I think he had a big, thick beard at the time and stuff, and, you know, we were all kind of looking at each other, but he just blew us away. I mean, he just understood exactly what the issues were, laid out the issues, and really gave a path forward for us as union activists to begin to think about the healthcare crisis. And 2 years after that, we were running bus trips to Canada where we were sending local union leaders to look at the Canadian healthcare system so that they understood it and they could talk to Canadian workers and Canadian patients and begin to feel very comfortable with the idea that there were other ways to provide healthcare rather than to treat it as a commodity that you had to purchase like soda pop or beer. So we have a long background, a long history with PNHP, and they've been there from the beginning, and they will be there on the day of victory. Now, 2009, about 2 weeks before the inauguration, we founded the Labor Campaign for Single Payer. It's a very hopeful time, if you all remember, and one of the hopes was that this whole issue of the right to health care, which had been festering in the shadows for a long time since the defeat of the Clinton healthcare debacle, don't get me started on that, but that had been festering in the shadows was finally going to come to light, and we're going to really debate the best path forward to provide health care to everybody in America. So a number of activists, about 150 of us, came together in a national meeting to try to figure out how to orient the labor movement in this direction. And we felt that it was very important to move this issue from where it was strongest in the labor movement, which was at the grassroots, at the local union level, the regional levels, where people were engaged in these horrible fights day in and day out to win health care for their members and for the communities that they lived in, and to move that up into Washington, where people sometimes get so sucked into the inside game that they forget about what they're there for. And we felt that labor was really crucial to this fight for three very important reasons. First of all, it's my belief that it's a historic mission of the labor movement to win health care for all. This is what has happened in every industrialized country in the world. Labor has led this fight. And in the process, we need, as a labor movement, to really return to our roots and understand that we fight for the needs and the concerns of all working people. And the fight for health care for all, in my mind and in the mind of a lot of labor activists, is connected with this idea that labor has to, in order to survive, has got to transform itself or go back to what it used to be, where it could speak not only for the decreasing number of people who are lucky enough to work under a union contract and speak for the interests, the concerns, and the futures of all working people, and we see health care in that broad context. Secondly, we can't bargain health care across the bargaining table anymore. It's just not possible to do it, and anybody who's been engaged in collective bargaining in the past, 20 years really, understands the obstacles there. You have a system, a health care system, provided through private insurance or sometimes through union funds that have to purchase private products, insurance products, and healthcare products, which is increasing in cost at 2, 3, 4, 5 times the rate that our wages are increasing. And if you just draw those lines and see where they intersect, you realize that it's just impossible to keep doing that. Private insurance provided through an employer is on its way out, and labor may be the last folks to hold on to it, but it is on the way out. It's the biggest cause of strikes, lockouts, all kinds of labor disputes. We've got to get it off the bargaining table. And finally, labor is important because when labor finally engages in the fight for health care for all in a real way, it will change the whole game. Because labor, despite all of its weaknesses, it has the capacity to put real people on the ground. It's the only real institution we have in this society that is not controlled in some way or another by corporate money. It's funded by working people, and it has the capacity to speak for them. If we put the resources on the ground on a fight for health care for all or a legislative fight in a specific state to the same level that we put it on to elect these do-nothing politicians who tell us sometimes even before we elect them that they're going to sell us out. If we could do that on health care, we could change the whole balance of power on this issue. So labor is crucially important to this. And in this whole period, the last 2 years of debate over health care, I think we've made some tremendous strides as a movement, both in the labor movement and in the broader movement for health care for all. And it's important that we remember that as we look to the future. One of the most significant achievements of the labor campaign for single payer is we did pass a resolution at the AFL-CIO convention in 2009 that put the Federation on record as supporting a single payer system. We did that based on a grassroots campaign where there was more resolutions submitted by local central labor councils and other organizations than on any other issue in the history of the AFL-CIO. We forced those national officers to take a look at this. And it was a very thoughtful process. What the key language in this resolution was directed to the future because we understood we were in the midst of this fight and it was unlikely that we could completely turn this ship around that was headed towards the engagement with the what eventually became called PPACA. So the essential language in this resolution said that whatever the outcome of the current debates in Congress, the fight to establish health care as a right, not a privilege for everyone in America shall continue, and it shall be the labor movement has got to engage in that fight. So we wanted to position ourselves as coming out of this debate for PPACA with a more unified labor movement and a more unified, broader movement in our communities that could keep moving forward and keep the fight alive to win health care for all. And as you know, the only way you can establish health care for all in this world is to get private insurance out of the business of selling health care. It's a flawed business model. They make money by denying health care. You can't use that institution to provide health care because it's like using tobacco companies to educate our kids or something. I mean, it's ridiculous. So we have to move in that direction. Now, this past year, as the good congressman indicated, there was a law that was passed called PPACA, Patient Protection Affordable Care Act, and I think all of the speakers are going to address some portions of this. And you know, there were some good provisions in PPACA, provisions that are important for a lot of people. There will be millions of people who will have access to medical care if PPACA is fully implemented that would not have had access otherwise. People will be alive who would have died otherwise. So I don't want to underplay those provisions. But I would say that perhaps the best achievement of this whole debate that resulted in this law is that there has been an expectation created that people have some kind of a right to health care and that the government has some responsibility for making sure that that right is implemented. I think that that's the best that we can hope going forward. because PPACA is inherently unstable. It's, first of all, it's under political and judicial assault right now. The thing you just saw, the votes in the House and the Congress on it, were just, that was kind of just show for the teabag new majority in Congress. It didn't really mean very much, but there will be and the people in Washington are really good at this, the death of 1,000 cuts attack on these. These provisions will be stripped out one at a time. If history is any judge, the Democratic administration will respond to these little attacks by constantly moving backwards and, you know, making one concession after another to the bill. They'll go after the most progressive portions of PPACA, look to a revival of that movement to sell unregulated health care insurance across state lines is a great way to save money and all of that kind of stuff. Those are the kind of attacks we're going to see on PPACA. There is also this judicial attack. There is a chance, it's an outside chance, but you know, not completely out of the bounds, considering the far-right turn of the Supreme Court in recent years. Who knew that they'd rule last year that corporations had the full rights of human beings? So there is a chance that the Supreme Court will find this rule unconstitutional, the individual mandate that requires people to purchase health insurance, which is the linchpin of the entire PPACA bill. You know, they won't find it illegal for the reasons that we think it's immoral, that you're forcing people to purchase defective products and creating that expectation that you can't fulfill. But they'll do it based on these right-wing libertarian free market philosophies. So, you know, there's nothing really that we can say or do that will affect the outcome one way or another, but we have to be there to pick up the pieces should that happen. In addition to that, even if it survives the political and legal assaults, there's no way they can pay for the kind of health care they've promised to provide the American people. It's just unsustainable. There's people who feel that we won't be able to budget for it before it's even fully implemented in 2018, that it'll begin to collapse of its own weight. The cost of trying to purchase private insurance and then guarantee that everybody has access to it is just, it's going to be insurmountable. So there is an ongoing opening, an ongoing opportunity, an ongoing need for us to organize around health care as a human right and around a single-payer solution to the health care crisis. And if we're not there as this thing collapses, all of the ugly sort of blame the victim, blame everybody except the people who caused this crisis, that right-wing populist force will be there, and they'll turn this collapse of this health care into a very nasty and ugly thing, which will make it hard for us to ever move forward. So we have to be there. And this movement has got to continue. So we've thought in the labor campaign a lot about what we need to be doing in the near future to move forward on these issues. And there's several areas that are very important to us. And I'd like to kind of throw them out to you for your consideration tonight as you deliberate on how to move this issue within Washington State. You know, first of all, we have to continue to be present in the national debates over health care. You know, we know that in the next 2 years, there's not going to be a bill out of Congress that is going to move us any closer to single payer, but there has to be continuing, ongoing progress nationally. Congressman Conyers is going to resubmit H.R. 676. There's a number, I think he's up to about 20 sponsors at this point in time. There had been 85 sponsors in the last Congress. There's 79 of those folks are in this Congress, and there's a few other people who have gotten elected who are likely to be supportive of single payer. So, you know, that process will continue. I have to say a number of us were not all that happy with the role that those single payer champions played in the most recent health care debates. And, you know, we feel that, you know, our support has got to be conditional, that there has to be more accountability to a movement outside of Congress, and that it's our job to build that movement and to force that accountability. So, you know, we're hoping that, you know, we've learned from some of the problems in this last Congress, and we'll move forward on that. In addition to the Conyers bill, Senator Sanders is working to submit a new bill in the Senate. He's actually working with Congressman McDermott, and he's been meeting with some labor folks to talk about some provisions that are of particular significance to labor, including ways to make sure that union welfare plans, what's called Taft-Hartley trusts, would continue to be able to provide benefits that are not covered under this plan, and that the unions would be able to negotiate those benefits, and also to make sure that workers who are displaced as a result of this reform receive an adequate and just transition into new and more productive labor. So we're working on that. In addition, there is a bill that's currently sponsored by all three of them, Vermont congressional delegation, that would, and I don't want to get into all the details now, it's a little bit complex, but would provide the necessary waivers to make it much easier for states to institute single-payer programs. So, and that bill, because it has a certain states' rights flavor to, perhaps we can get through Congress with some winning over some Republican support in Congress. That's hopeful, and it's very necessary to move this thing around, because the next area where we have to really look to make progress in this political moment is on the state level. Many of you, I'm sure, have followed the news. Vermont is on the cusp of making some real changes and moving very much towards a single-payer system. There was a law that established certain standards that they have to create the right to health care in Vermont. They had a study commission that employed Dr. Shao, who is a renowned Harvard economist who helped design the Taiwanese single-payer system. He just made a series of recommendations, a number of options to the legislature in Vermont. The governor ran on a program of openly supporting single-payer. So the stars may be in alignment in Vermont to have a real breakthrough. And we're looking forward to that, because it could be a very symbolic achievement that can help bring this movement together. California is the next place that that is a fight of a different nature, but you have re-elected a Democratic legislature and a Democratic Senate, which has twice passed a single-payer bill in the last 2 sessions, only to have it vetoed by Governor Schwarzenegger. Well, guess what? Schwarzenegger is not governor anymore. There's a new governor in California who, at least back in the day, was a single-payer supporter. He was very careful not to talk about that issue during this election campaign. So that we have a lot of challenges in California, but again, there's been a powerful movement that's already achieved a number of things, and if California moves on single-payer, the whole nation will move. California just has such a huge weight that it can't be ignored. If it does it right, the whole nation would move. So we're paying a lot of attention to that, as well as campaigns in a number of other states, and including the Washington Health Security Trust movement here. I know that that's had its ups and downs. There's talk about reviving that movement. I think that's people need to really think about how to do that strategically, make sure that everybody is in the room, so you do it from a very unified revival, and don't do it hoping that later on people will come to it. I've found as an organizer that if you don't have folks in the room when you first start out, it's much harder to get them in the room later. So it's really worth the effort to build a movement around this bill and take the time to make sure that that happens. One of the things I really do like about the proposed bill is that there is set-aside money in that bill that does provide to payments to transition workers into more productive employment, and that's, it's very important to labor to see those kind of things. In addition to that kind of legislative fight, I believe that our movement for health care for all has got to align itself with the broader movements in our society who are fighting to defend and expand what we call the social insurance model. That's the sense that any human society ought to provide basic provisions for dignity and security for all of its, everybody who lives in that society. Things like Social Security that people fought and died for. Things like Medicare, which is a precursor to a single-payer system. Public education. All of those benefits, those insurance models, if you will, are under attack right now. We think that we have to allow, those are our natural allies. The people who are fighting to preserve Social Security, who are fighting to preserve public education, are our allies, and we have to reach out to them. We have to build a movement that fights not only to defend what we've won in the past, but to expand it to all Americans and to increase that security. And that is really our challenge, and those are our allies, and those are our future. And that means acting in solidarity with workers who are trying to fight to protect their health care. There is a vicious assault on public employees that is taking place in this society. We had a labor meeting Thursday night. The representative from the Federation of State, County, and Municipal Employees said, you know, I never knew until recently that it was public employees who caused the whole Wall Street crash and the housing bubble and everything else. But they have demonized public employees. And this is, they are the strongest core of union presence in our society right now. And if they destroy that, they will fatally weaken the union movement. And we have to find ways to align with those fights to defend those workers and to encourage those workers to expand their fight to defend their hard-won medical benefits into a fight for health care for all, to provide the benefits that they used to have to everybody in society. And that's going to be a real challenge, and it's really important. And we in the labor campaign look to work within the labor movement to transform the movement so it's capable of waging those kind of fights. We have what's called a winter meeting of the AFL-CIO coming up, where we will be making specific requests, including that they support with financial support and organizing support the Vermont campaign, and then hopefully that sets a precedent for future statewide levels. We've also been having a number of meetings with leaders in the Washington State labor movement, and it looks like we will be attending the Washington State AFL-CIO convention in August, and we're hopeful that a number of unions will be coming to that convention with a proposal that the State Federation of Labor, which is the largest umbrella labor organization in Washington State, take up the cause of single payer and align itself with the broader movements in Washington State. I met with the new president, Jeff Johnson. He committed that he would invite someone from the labor campaign to address the convention, and that if the convention passes it, that he will serve on our national committee. So it's a real challenge that we have within the labor movement. We need your help where you can give it to encourage our labor allies to move forward here in Washington. So that's sort of the overview. And I just want to give you one last quick piece of advice as an old shop steward. The thing that disturbs me the most about the politics of the healthcare movement, I understand that there's times to compromise, that you need to get, you have to defend your base, you have to make accommodation from here for one reason or another. But what really concerns me is this trend that continues again and again of bargaining against ourselves. This is something that every shop steward learns not to do, usually within a month of getting elected as a shop steward, or they don't stay on as a shop steward. This idea that you bargain off of the other side's demands, and you make concessions in advance to the other side in the hope that they'll see that you're reasonable and come your way. I mean, even if the goal of the labor movement, the bottom line would have been to have some kind of a public option, to start the bargaining process on your last demand, your fallback demand, is just raging idiocy. And please, whatever we do as we move this movement forward, let's not fall into that mistake of bargaining away our power before we even get to the bargaining table. Let's stand strong on single payer. Let's keep our eyes on the prize, on the future, on what we need to do, and let's move forward in a united direction, and we will win. Thank you very much.